Good morning. Happy Friday. I have Neuro Coffee in hand and it is perfect. Man, we had a great week. So let's wrap this up with a really cool Q&A. It addresses a situation that I'm very fond of talking about, which is the iterations between the pelvis and the thorax. And it comes from Ryan. And Ryan says, I have an interesting chessboard that I'd appreciate your insight on. The patient of interest has a wide ISA with bilateral upper dorsal-rostral compression, left greater than right, and a right anterior upper thorax compression. They also have a limitation in right forearm pronation. So remember that orientation because it's going to show up here in the next paragraph. Lower body appears to be iterative, so Ryan's on point already. So it's iterative to the above presentation with bilateral hip ER limitations and a right hip IR limitation. They also have an early propulsive foot on the right that has difficulty dorsiflexing-pronating-everting. So this person comes to Ryan with a complaint of a right lateral foot pain with an increased running volume. And if we come up with a solution, I really think that this foot thing is going to be addressed. But it's more important that we talk about what this representation really looks like and what's happening, and then we'll talk about some strategies to resolve it. So let's grab a pelvis and let's see what this thing looks like. So Ryan mentioned that we've got dorsal-rostral compression in the upper thorax. So if we look at the iterations, dorsal-rostral compression in the thorax would also be representative of this posterior upper compressive strategy in the pelvis. Now, it's compressed on both sides, but Ryan also mentioned that they have a greater loss of external rotation on the left side versus the right. So we know the right side is leading. So we got a little bit more of a compressive strategy that's pushing this left side forward, which means that everything's going to be turned to the right. Now, if we look at the upper thorax, he says I've got a right anterior thorax compression, which means that I'm going to lose some shoulder internal rotation on this side. And guess what? We have a loss of hip internal rotation on that right side too. So Ryan, you've got a little bit of an anterior compressive strategy going on here in this right pelvis as well. So again, we got this great match. Now, let's talk about the forearm and the foot, because this is really cool. So Ryan was smart enough to check all the way down into the forearm and the wrist to identify what he's actually looking at, which is an awesome thing to do. Remember, we're treating the whole person here. And so he identified the fact that this person does not have normal pronation in that right upper extremity. And then he says, well, we got an early propulsive foot too. So let's take a look at that. So my early propulsive foot is an ER tibia. The tibia is behind the malleolus here, okay? And I'm going to have a decent arch in the foot. So that's my early propulsive strategy in the foot, which means that I have a foot that's going to be biased towards external rotation / supination. And so they can't pronate the foot either. So we have this beautiful, beautiful iteration from all the way from the ground all the way up to the upper extremity, which means that if we really want to clean this thing up, we may have to go into the upper extremities to make sure that we have a full restoration of movement capabilities throughout the axial skeleton and throughout the extremities, so this person does not have a recurrence of this strategy during their running. Okay, so what are we going to do? Okay, so a couple of strategies. If you want to go manual, if you're a manual guy, you might want to use the right lower extremity manipulation that I show on YouTube to try to recapture that middle propulsive strategy from the foot on up. And so that's a nice little video for you to watch. When we talk about the upper extremity situation, we also have manipulations up there too. I would probably look at something that utilizes the radius at the elbow, where you can drive pronation from distal to proximal through the wrist. We get a nice little manip at the elbow, and that's going to drive shoulder internal rotation as well. But there's a number of strategies that you can do up there as well. We've got scap decompression that we could use. Also, I have a video of that on YouTube as well. That's going to get you that dorsal-rostral expansion and get you the restoration of some of your external rotations. If you're a soft tissue guy, identify your concentric orientations, and that's where you're going to want to spend your time reducing that. So if you've done all of that, Now we want to think about, well, I need this person to actually learn how to manage this thing themselves. So when we teach them how to reduce this anterior orientation situation, so we're going to use some form of hip extension. The question mark is how much hip flexion do you have available to work with under this situation? If you do not have 90 degrees, so if I don't have hip internal rotations, then chances are I don't have 90 degrees of hip flexion to work with. So I can't use anything in that range. So I might have to drop them down into hook lying. I might have to work on some posterior orientation activities in the pelvis so I can work through an excursion of that hip that I do have available. Once I do that, I have to create a delay strategy on the left side. So we're going to do some form of hip shifting. We got to push back on that left side to create some yielding strategy on the left to create the delay of the propulsion, because that's what's pushing everything forward. So what it's going to look like, it's going to look like that picture right there. If my technology is friendly today, you're going to see a picture of a before situation that's probably going to look a lot like Ryan's patient here. And then what we're going to do is we're going to teach them how to expand posteriorly on the left with the yielding strategy, and then it's going to look like that picture right there. So again, hopefully my technology is working and you've just seen a before and an after of this situation. Now, once you recover pelvic orientation, yielding strategy, now we got to flip-flop our strategies. We got to get the right leg ahead of the left and push back into the left. We've got to train the right side through middle propulsion. So in a lot of situations, what I'll do is I'll take people out of their shoes, get their foot on the ground, so we can translate that tibia over the foot actively to start to drive through that middle propulsive phase. So those of you that are thinking heel rocker, ankle rocker, toe rocker, this is your ankle rocker as well. If you need to go into the upper extremity, you're going to want to try to drive something very, very similar in the upper extremity that we just talked about with the right lower extremity lead. But in this situation, it's going to become like a right oblique sit with the forearm in pronation. It's going to progress into some form of side plank in the gym. If we continue on into the gym, you might not be able to use 90 degrees right off the bat, because if I put somebody in half kneeling, they can't recapture their internal rotation right away in an upright position, because I've got external rotation on both sides of the pelvis, which tilts the pelvis on a bit of an oblique axis. However, I can bring them up into a staggered stance situation, and so now I can get my cable chops, I can do a high-low cable press, and I can work some backward sled drags, and so now I can be effective in the gym. I can maintain my posterior expansion, the yielding strategy on the backside. I can push off that right foot into the backside, and now I have just reoriented everything and I'm maintaining all of my changes. So Ryan, I hope that gives you a few ideas on how to approach this, so you can go manual. You got to recapture the positions and then reinforce that stuff in the gym. But it's a great representation of the iterations. Thank you so much for the question. If you have any questions yourself, ask billhartman@gmail.com. Ask billhartman@gmail.com. Have an outstanding weekend, and I will see you guys later.